Jet DOYE, Vice President of Advancement for Skid Row Housing Trust.
Hi, Monica. Thank you. And thanks everyone for being here with us today and making time to get to know our guests. We're really excited to have Beth and Rudy here and have admired so many of the innovative steps that Kaiser has taken, especially as an impact investor in housing. We think that that's an important trend, and we're looking forward to learning more about it. I'm sorry Lee can't be here today. She's actually right this very minute hosting a strategic planning session for our health and social services team. It's an exciting time of year for us. You know, this is the end of our 5-year strategic plan at the trust level. And so new strategic plans are being developed for the property management company and for health and social services, and those will feed into our overall plan for the trust. It's Thanksgiving, which is an incredibly important time of year in this community and every community, and we're all really pleased and excited. I'd like to give a shout out to our colleague Dre Comers, who leads the Experience and Engagement Group. Dre has made the Thanksgiving arrangements this year for all 2,000 of our residents in 30 buildings. And on top of that, he's hosting a raffle for 36 turkeys that we got from our partners at Council District 14. Monica referred to the Housing First Heroes campaign in the agenda, and I'll be telling you more about that at the end of the meeting. But for now, I'd like to turn it over to our Chief Financial Officer, NADIA LITOVSKAYA, who'll be introducing our guests and hosting our panel.
Hi, everyone. Welcome to our virtual community meeting. Nadia LITOVSKAYA, Chief Financial Officer for Skid Row Housing Trust, and I would like to welcome Elizabeth and Cody to our conversation today. Welcome both. Hi, very nice to see you and meet you, and looking forward to this discussion. So a quick intro for both Elizabeth and Cody. Elizabeth, who currently serves as a regional manager of upstream community health for Kaiser Permanente Southern California, is a public health professional with over 23 years of experience. She holds a Master's of Public Health from Boston University School of Public Health and a Bachelor of Arts in Public Relations from Ithaca College. In her role at Kaiser Permanente, Elizabeth promotes the organization's positive impact on health of communities by leveraging all the organizational assets, including and beyond coverage and care, to address the social, economic, and environmental determinants of health. Her key areas of focus are activating Kaiser Permanente's anchor strategy to build economic opportunity and to lead the region's strategy on housing and homelessness. Welcome, Elizabeth. And Cody brings more than 25 years of healthcare experience focused on improving healthcare business operations, care delivery systems, and preventing disease and promoting well-being. In 1999, Cody joined Kaiser Permanente's Health Plan Regulatory Services. He negotiated Medi-Cal health plan contracts and ensured contract business operations and delivery system compliance. In 2002, Cody joined National Compliance Office, where he conducted audits and action plans under the auspices of Medical Directors Quality Review. In 2003, Cody joined Government Community Relations to work on community health projects. He was one of the 3 staff members transferred to the newly created Community Benefit Department in 2005. Cody grew the grant portfolio from $1.5 million to $25 million and developed key strategic grant initiatives and partnerships. In his current role, he's responsible for grant making, strategic planning, policy compliance, fiscal management, and business process improvement functions. Welcome both. So good to talk to you today. We have a couple of questions for you guys, and if you can jump in, if I'll direct a question to one or both of you, and then we can kind of have a discussion about these topics. So Elizabeth, as a senior director, and Cody as the manager of community health, can you both talk about your roles and responsibilities at Kaiser?
Sure. Maybe Cody, I'll jump in first and then toss it to you. Well, thank you so much for having us and for making time to come. Thank you, Nadia, for moderating this panel. As was mentioned, I'm the Senior Director of Community Health for Kaiser Permanente. I support all the community health operations in our Southern California region. I've been at Kaiser Permanente, I think going on 16 years now, kind of both in multiple roles, embedded in the medical center and also working in our regional sort of corporate offices when we were in our corporate offices. But I've always had my hands in our community health work in some way or another. And in the role, I co-lead our community health portfolio for the region, which includes actually the communities essentially from Kern County all the way down to San Diego with a few exceptions. So we're not in the area around Santa Barbara, we're not in Imperial County. There's a couple other pockets, but for the most part covering the vast majority of the Southern California region. And our community health portfolio is actually very broad. It's a national portfolio for the organization, although we do have some priorities and areas of focus that are really unique to Southern California. But the work by and large revolves around our participation in the Medicaid program, as well as our charitable health coverage. Obviously the Housing for Health work, which we'll talk a lot more about today. We are doing a significant body of work around advancing economic opportunity, addressing poverty. We have some new areas of focus around addressing intergenerational trauma and healing, environmental stewardship, and what is the impact a healthcare system has on the environment, both in our operations, but what can we also do to invest in programs that improve that? We are working hard to embed sort of social health screening and a social health practice into our operations in partnership with operations. And then we also participate and actually co-direct a program called City Health in partnership with the de Beaumont Foundation, really focused on public health, a public health policy agenda for our largest cities. So it's a very broad portfolio, but it's focused in some ways kind of in two major buckets. I think our work endeavors to really improve the conditions within which people live, mindful that health is determined by so much more than medical care. So these things like access to food or housing or safe drinking water and air quality all really have a tremendous impact on health, which we're very committed to as a healthcare organization. But we're also very interested in introducing sort of social health and the importance of social health into our own operations and into the health system very broadly, because we know that physical health is important. We certainly know that mental health is important, but we also believe that social health is sort of the third leg of that stool for anyone to be truly healthy. And I know we're going to dive more into the housing and homelessness work we do specifically, which Cody leads. So I'll turn it over to him to introduce himself and maybe talk a little bit about that.
Great.
Hello, everyone. I'm Cody Rutherflotis, and thank you for sharing a little bit about myself and my bio. I also want to add that I'm a fourth generation Angelino and happy to be here with you. I have a dog in the background that's barking, so please forgive her a little bit. But good morning. I'll talk a little bit about my role at Kaiser Permanente. My role in the Southern California region in community health has been traditionally to plan and design and implement and evaluate various community health programs that, as Beth mentioned, address health inequities, and ultimately, try to move towards improving population health, particularly with underserved and low-income subpopulations. And my day-to-day work includes managing our corporate grant-making portfolio of grants that we award to nonprofit organizations, academic institutions, and local government entities. My portfolio includes work on Housing for Health that you'll hear a lot more shortly, but also our safety net partnerships. And our safety net partnerships works to expand access to quality healthcare by supporting public hospitals, public health clinics, and federally qualified healthcare centers. And many of the FQHCs that we support also have the federally designated H status, meaning their clinic patient populations includes serving homeless populations, and this could be for unsheltered, temporary housing, transitional housing, permanent supported housing, or formerly homeless individuals and families. And with my experience working on healthcare for the homeless, it created a really nice opportunity for me to work on our Kaiser Permanente Housing for Health portfolio. And the portfolio is growing, and it has 4 strategic pillars that I'll just share briefly with you all. The first is that we want to transform care, and this includes strategies that strengthen the connectivity and the provision of care within healthcare and social safety net organizations for people experiencing homelessness. The second strategy is we want to strengthen the homeless response system of care. This includes system level approaches to improve long-term housing placements and drive towards reductions in population health goals. We also want to prevent homelessness through different cross-sector investments, interventions, and collaboration to address housing instability and reduce homelessness. And lastly, we also want to increase the affordable housing supply, and we do that through strategies that preserve and stimulate and enhance affordable housing units in service of reaching population level goals. And I think today we'll give you some examples of that body of work and dive a little deeper. But essentially, that's my role, is managing this Housing for Health portfolio of grants and partnerships.
That's fantastic. I mean, you guys probably covered the majority of what I was going to ask you, but we can definitely dive into details. I mean, it really sounds like what your vision is and what you've been working on is a complete wraparound of not just healthcare, but establishing a safer and healthier community in general. So thank you, both for working on that. And so this next question, it may be for Cody, since, you're focused more on housing and it's more focused around the vision. And in 2018, Kaiser Permanente established the Thriving Communities Fund, which is a $200 million fund to take on housing and instability and homelessness. And as a healthcare provider, what were the specifics and what did you see in the community that kind of made you focus on that? And you touched on that a little bit, but if you can go a little bit more into the specifics.
Nadia, I think I might take this one because I was a little more engaged in it at that time when the fund was being established. I think like many of you probably, I think we were watching, the immense challenges in affordability across California and many other states where Kaiser Permanente operates. Housing costs were skyrocketing. We were seeing a marked decline in the number of middle income housing that was being developed. And certainly an increase in the size and the number of homeless encampments and, people experiencing homelessness living under bridges and overpasses in really along major city streets, not just here in LA, but in many of the smaller communities where we operate, in some of the rural communities where we are, pretty much everywhere in our footprint. We were also really seeing a lot of changes very unique to Kaiser Permanente, or maybe to healthcare. I think many patients were coming into our emergency department and our urgent care centers who were homeless, many suffering with significant mental illness and substance use disorders. But we were also seeing many who were self-identifying as homeless for the first time and kind of disclosing to our clinical teams that they didn't really know where to reach out for help. And truly the encampments and communities of people experiencing homelessness were also even more in like our day-to-day vantage point, because we saw encampments being established on our own Kaiser Permanente property. We saw people sort of living in their cars in our parking lots, and encampments sort of alongside, streets where our main, entrance to our campuses may have led. And so leading up to the creation of that $200 million fund that you mentioned, there were 2 things happening in the organization that I think really propelled our work into this space. First, and I think really importantly, is that our CEO at the time, the late Bernard Tyson, really threw down the gauntlet in like 2016, 2017 and said, you know, he demanded we become part of the solution to this problem. And he often told the story when he talked about our commitment to housing and to homelessness, about driving into his office in Oakland from his very nice neighborhood into his office, which was also very nice and had a beautiful view, but he was driving day in and day out right past one of the largest homelessness encampments in the city, and that it was just something he could no longer bear witness to. And he was not going to be satisfied with just sort of addressing that encampment space. He really wanted to see Kaiser Permanente show up as part of the solution. Concurrently going on sort of organization-wide, we were beginning to prioritize how we were going to refocus some of our community health agenda. And we're always constantly taking stock in what we're investing in, how we're engaging, what new partnerships we need to establish. And so, of course, in talking to community, to our partners in the community, to members of the community, to our own patients, homelessness just really rose to such a critical issue. It was sort of the first or second high need priority that we identified. And it was very much in line with our belief that at community scale, it's these economic and social circumstances, much more than medical care, that increasingly influence people's health, and with affordable housing being a really pressing issue. And then clinically speaking, looking at the research, really thinking about the true impact of homelessness on health. You know, the average life expectancy of people without housing falls by 27 years compared to their housed counterparts. So if we were truly going to be an organization, a healthcare system that was committed to total health, then this is something we were really going to do, and we were going to do it in a really meaningful way. And so I think that was the landscape going on for us, and that's what really paved the way for the organization committing $200 million of our private investment capital to really addressing social impact needs, with housing and homelessness being at the top of that list.
Right, and Cody, I don't know if you want to add anything to that, but you know, it sounds like you guys are looking at this as a big picture and not just one problem, and expanding just your vision and your support of the community is just so impactful. And you know, in line with that, and you touched on that, Elizabeth, a little bit, you know, the partnerships that you're creating through this process, and you know, as you're leading efforts to end homelessness and prevent homelessness and preserve affordable housing, what are some of the policies, and actually, you know, if you can add some specifics and specific partnerships that you've committed to, you know, support the expansion of affordable housing? Who are you guys working with, and so on?
Sure, Beth, I could jump in and take this question.
Please.
Great, thank you. Well, I think we have a number of different strategic partnerships that I could share. I think I'll start with our partnership with enterprise community partners, and if we have more time, we could talk about some others. Enterprise community partners, for those of you who don't know them, they're a national nonprofit addressing the shortage of affordable rental units in homes. They work on solutions such as programs and policies and capacity building. They also endeavor and work on capital, such as tax credits and debt and equity and asset management. And they also do some really good work in community development, such as property management and resident services. But my example of the partnership with Enterprise is actually a partnership also with the state of California's Department of Housing and Community Development, where we supported Enterprise with a $25 million grant to establish a services and operating subsidy fund to support Project HomeKey sites with additional operating costs and wraparound service supports for up to 1,000 new state-supported housing units. And we awarded the grant because we saw an opportunity to engage in a public-private partnership to help California's homeless residents get through COVID-19, and to also, you know, address the critical need to have more permanent supportive housing development in a quick and in a more cost-effective way. And also at the time we saw that there was going to be an unprecedented amount of federal funding coming into the state through the federal coronavirus relief funds to really assist local public entities in purchasing and converting these hotels and motels and vacant apartment buildings and other properties into long-term housing. And also we saw that the state was also investing millions of dollars through the California General Fund to pay for Project Homekey sites. However, at the time, because the state was limited in how many projects could be funded with the amounts of operating funds they had available at the time, it presented Kaiser Permanente with I think a unique opportunity to address a challenge that some under-resourced cities and counties who did not have the operating funds available may be not able to participate in Project Homekey. So as a result, we invested that 25 million into the subsidy fund to provide additional operational and supportive services for these newly acquired sites. And I think in short, the partnership with Enterprise in the state for us at Kaiser Permanente, we saw it as a way for philanthropic funding to really create some synergy with public funds. And we saw it as an opportunity to leverage our grant dollars with these public funds to have a greater impact. And we also, I think, when we worked on the grant, we also thought that Enterprise, through their role with the state and Project Homekey, can really accelerate creative and flexible service models that we think could advance the field's knowledge and capacity to better serve people transitioning out of homelessness and to keep them stably housed. So the partnership collectively brought in $46 million in philanthropic funds, our funding from Kaiser Permanente, plus the Blue Shield of California, and the Chan Zuckerberg Initiative money was brought together to help support these operating costs. And I think many of you are aware of the outcomes of Project Homekey. We're excited about the current state funding opportunity for Project Homekey 2.0. We think I think it's 1.4 billion that was approved by the state for fiscal year 2021, 2022. And we're also thinking about how can we might make another investment to Enterprise to create this public-private partnership and support Enterprise to provide some expanded technical assistance and some strategic advice for pre-application project development and due diligence for local public entities that are thinking about applying. This would include some support with operations and capital budgets, land use entitlements, building code, support services, planning and budgeting, community engagement, and supporting documents needed for their application submission. So I think that's one example of innovative partnership for us at Kaiser Permanente to really think about how we can collaborate with some new partners and to invest our dollars to have some really significant impact.
Yeah, thank you for that, Cody. Enterprise is also a very good partner of ours, so I'm very familiar with their operations and their mission, how impactful they are in the community and throughout the state. So I'm really glad to hear that you as the organization are also working with them very closely. One thing that you touched on a little bit is, COVID impact and the different, funding that's coming into the industry, but how did COVID change your strategy in housing stability and affordable housing since, before COVID? Has anything changed in your direction, how you're, where you're going towards in the future?
Sure. Yeah, I could answer this question too to start with. I think we maintained our four strategic pillars that I mentioned at the onset. The transforming care, strengthening homeless response systems, preventing homelessness, and increasing affordable housing during COVID. What I think that's changed for us during COVID was really how do we kind of accelerate the speed of activating our strategies, also the depth of what we're investing in relative to those strategies, and also and very important, how do we identify new partners to help activate our strategies. And I think COVID was, I think, a catalyst for us in a sense, because as a large healthcare organization, decision making is often slow and requires buy-in from multiple leaders within KP. We kind of often joke around that the slow decision making speed is our Kaiser time, and sometimes I joke around with our partners that KP decisions are slow, but they're usually worth the wait. But I think COVID-19 really changed the way we kind of operationalize our grant making in our portfolio, and it really required us to pick up our Kaiser time pace and our tempo, and make investments more quickly to respond to. So I think the way we operationalize our grant making during COVID changed, and we awarded some grants to national partners that were larger than we normally do. Our grant budget increased in our contributions in what we award, as illustrated with Home Key. We're very interested in working with new partners like the Chan Zuckerberg Initiative and other foundations and other public and private organizations. So I think it was a catalyst for us. We maintained our core strategies, but really we kind of enhanced our operation to respond to COVID.
I think I would just add to, I mean, that was kind of well summarized. I think the also, in the midst of it all, we had the murder of George Floyd and sort of the reckoning within the country to really come to terms with the racial inequities. And we were on the front line of the COVID pandemic in terms of patients and care delivery and hospital utilization. And we saw firsthand the disproportionate impact of the pandemic on our Black and Brown neighbors in our communities. And I think our organization really, in a way that we hadn't seen before, sort of long been committed to equity, but kind of doubled down to say, we're seeing firsthand the challenges that people are living in their communities, the racial inequities that are causing some of the vulnerability to COVID. And we've long been seeing it. We're seeing it like fast right now in real time, and it's time to really reorganize our whole focus and center it around racial equity. So a lot of what Cody's speaking to and the work we're doing in our investments and our work in housing and homelessness really refocused around that as well.
Yeah, and you touched on a really good point, because truly COVID has reset certain priorities for a lot of organizations. And, I think I can appreciate what you guys are doing, particularly because our own organization had to do that as well. And kind of like Cody had said, there's the KP time, and then this is probably KP 2.0 time, right?
Yeah.
And you kind of had to change the processes and speed up things and align with what's really going on in the city, in the county, and nationally. So thank you for that. And kind of aligned with that, Kaiser Permanente has created over 5,000 affordable housing units in just 3 years. And can you talk a little bit more about that and, the homelessness portfolio nationally and here in Southern California, if you have, what it is now and where you see your portfolio growing and into which areas?
Yeah, so, as Cody kind of outlined in our strategy, we are rolling up, we are very aware that the homelessness crisis and the housing crisis really independent crises. They're certainly interrelated, and our strategy is really rolling them both in to try to tackle them through those different work streams. And one of them is really around just production and preservation, and it's something that it's something I'd say, unlike probably many of you listening, is new for us. You know, we have not been in this space very long, but we think there's a meaningful contribution that we can make. The main mechanism for our housing investments, the 5,000 units you refer to, Nadia, is really our Thriving Communities Fund, as I previously mentioned. Although we do have some unique grant investments that also support preservation and development, and the Home Key, you know, example is a good one. But the Thriving Communities Fund is sort of one way that we really focus a business asset within the organization. It's not our community health work. It's not our grant making. It's not our care and coverage. It's really a business function of investment. And being able to leverage this, we feel KP can really play an important role kind of as an anchor institution serving the people in this community. So to date, I won't get into the super details of the numbers, because I think it's not, I mean, we're proud of it. It's just the detail probably isn't important, but I will say we have had 4 major investments so far out of our Thriving Communities Fund, pretty significant. Enterprise Community Partners, again, a strong partnership with Kaiser Permanente since 2016. And obviously the Home Key work Cody mentioned, but they were actually our first big investments. In 2019, we invested $50 million with them to create the RX Home Fund. They matched our investment by leveraging another $50 million for a full $100 million fund. And so since 2019, Enterprise has been investing our dollars directly with developers, largely in pre-development, acquisition, and construction for traditionally financed tax credit type projects. So far, they've invested in 34 different developments across our whole Kaiser Permanente footprint. And that has created that's the bulk of our created units of a little over 3,000, I think 3,200. 5 of those developments have been in Southern California for over 220 units, I think, have been created so far. And there are several others in the pipeline that I get to hear about on a regular basis from the Enterprise team. There were then 2 investments that we made that were really focused on the Bay Area in Northern California. The second, we did another investment with Enterprise. We created the Bay Area Housing for Health Fund. That was a $15 million investment out of our Thriving Communities Fund, and it was to support really preservation in the Oakland area. And they have to date been able to preserve 750 units of affordable housing there. I think, or no, maybe that's their goal is 750, but I think they're at 600 or just over 600 already in a pretty short period of time. But preservation, you know, quicker and less expensive than creating new. And then we also had an investment with LISC, Local Initiative Support Corporation, also very active here in Southern California. But the Bay Area work, the Bay Area Futures Fund was a fund that LISC was managing. Some of the partners that Cody mentioned, like the Chan Zuckerberg initiatives involved, David and Lucille Packard Foundation, San Francisco Community Foundation, and others. They'll create through that fund another 1,000 units of affordable housing that is already kind of in the queue. And then last year, we invested in the Los Angeles-based SDS Supportive Housing Fund, which is a project partnership of an impact investor based here, SDS Capital, and a local developer, RMG Housing, for a really innovative model to use sort of private financing to source up to 30 developments to create 1,800 units of housing. That investment, they just closed that fund. We were a $50 million investor, but the whole fund was $150 million. They've got 3 sites already in construction and in development. That'll be about 130 units created. But again, there'll be up as many as 30 developments that partnership will ultimately create. And 20 of them will be here in LA County. So we're really proud that the vast majority of that investment will actually land here. And then the SDS fund particularly is permanent supportive housing. So that was an important fund for us because it really was about creating housing for people currently experiencing homelessness. And those developments, of course, will have the supportive services. Partners have already been identified, on-site space to support the case management and supportive services delivery for the people who are living there.
Mhm.
So that's kind of the
fantastic.
snapshot of the funds so far.
That's fantastic. I definitely need to pick your brain and connect with you in a little bit.
Okay, happy to do that.
That would be, yeah, that's really great to hear that. And, you know, it sounds like, you know, what you guys are trying to do is very innovative and, you know, kind of exploring different ways and options to create healthier communities and more sustainable communities, as well as housing preservation, which is very, I know it's Enterprise is a very strong supporter of that as well, but we are as well. So I know it's extremely important, especially here in Los Angeles, and it's just getting more expensive to build. So
There sure is. You know,
yeah.
Nadia, you also had, you know, I think just you'd mentioned sort of what is our longer term vision and sort of looking forward for this fund and our affordable housing portfolio. I think, you know, some of these funds will continue to develop and they'll continue to invest. No, none of the funds that we've invested in so far are complete. Like they haven't dispersed all those dollars. So the 5,000 units that are on the books already is great, but there will be more. And as Cody sort of mentioned, you know, our grant portfolio is definitely smaller than the investment fund we have, but we are beginning to develop some partnerships with very specific, you know, kind of innovative partners, CDFIs, that are where we'll have some smaller, but we hope impactful philanthropic investment specifically to catalyze sort of those innovative, more non-traditional approaches to development. And I think over time, our hope is to invest in new funds. We'd love to see our leadership kind of double down on this. I think the organization's really proud of this. So we're all pushing at the ground floor here for them to consider increasing the allocation beyond 200 million. We'll see if that happens. I know there's great hope that it will. And of course, when the investments are paid back, unlike a grant, these are, you know, equity and debt investments. We'll again recommit those funds into new and to different partners to really further support our strategy to increase the supply of affordable housing and really help these communities that we serve directly.
That's fantastic. Cody, do you have anything to add to that, and maybe like your personal long-term vision for what you are doing and just for the organization?
Yeah, I think what I'll add is that in terms of like what's next, I do have my eye on, you know, what Washington DC is working on with the social safety net infrastructure bill, and I'm hoping that that passes first of all, and that there's an allocation for affordable housing development. And if it does, you know, I think, you know, we want to continue to look at some of these public-private partnerships and think about how we can really leverage our dollars to really have more of that synergistic impact effect in communities. And I think what's next is to, you know, have, you know, further conversations with organizations like you all and others to see, you know, how can KP learn from you all, listen, and take that information to, you know, decide on how we invest our assets in the community. So I think there's some additional planning that we'll need to do on the short term, but the long-term vision is that, you know, we're working in partnership with you all and the public sector to really have some collective impact in this area to work to continue to reduce homelessness and increase affordable.
We absolutely agree, and I think, you know, it takes a village, so to speak, to start fixing the problem, and I think we're on the right track. So I think we're, you know, thank you guys so much for, you know, for the impact that you're making on the communities, on, you know, on the lives of people, and of course, you know, for your continued partnerships with organizations like ours and other organizations that truly see, you know, a light at the end of the tunnel, and working in creative ways to achieve those different goals. So thank you so much. Really appreciate you guys being here and kind of sharing your vision and your current state of the organization. So we'll
Thank
turn
you.
it over to
Thank you.
Jed.
Pleasure.
You know, I have not received any questions for you, which surprises me a little bit. We have been so excited to have the two of you on. You know, I think that we first started reaching out to Beth in the summertime.
Yes.
Yeah.
Yeah, it was
Oh.
an embarrassing long time ago, and your team has been working really diligently to try to accommodate schedules and make it work. So I'm glad we were able to do it today. Thank you, Jet.
You know, really congratulations on the work that you're doing. We've been following the impact investment space so closely, and I think that we and every other long-term developer of permanent supportive housing, and you know, our deepest roots are in housing preservation, and we've been at it 32 years, so we have portions of our own portfolio we're trying to preserve. There's so much to really be realized from impact investment in this space. The low-income housing tax credit structure has been fundamentally unchanged since the early 80s, and you know, like nothing else has been unchanged since the early 80s.
I mean, it's so important, that structure. I mean, I think it
Sure.
still is driving development and is a major tool that we know is, and I think with our RX Home Loan Fund, you know, we knew that those dollars would largely support developments in that, you know, as a small piece of sort of that capital stack. But that can't be the end all, or we'll never get out of this. So that's why we've been kind of excited to look at other models that really are leveraging private dollars in a new way that can be catalytic for cheaper housing, faster production, still high quality, still homes that people can be proud of.
Well, I love that you're doing it. I love that, you know, here locally, the Weingart Foundation has started to commit a portion of their $900 million corpus to impact investment. We see our partners at United Way raising an impact fund. They have a new typology that they're trying out. So there's just so much happening in this space, and Kaiser's really at the forefront of it. So thank you. Our Housing First Heroes campaign started on Monday and will run through the end of the year. We're very, very excited about this, and it's peer-to-peer fundraising. So our board members and leaders and team members and donors sign up and use tools that we provide to set up a website and ask their personal and professional networks to support the trust. And there are two primary ways to get involved. You can either make a gift or sign up as a fundraiser. And so, Monica, do you want to advance the slide? And we have the same calls to action at the end of every one of these meetings. You can donate to the trust. You can sign up to advocate. And, you know, we'll lift your voice up along with ours when we are asking our elected officials and others for important policies. And then you can join our mailing list. And if you are already on our mailing list, you can click the sign up button on your screen and send the link to a friend. And so with that, again, I'd love to thank our guests, Elizabeth and Cody from Kaiser today. It was fantastic. And to thank Nadia, our CFO, for moderating such an engaging conversation. And we will look forward to seeing everyone next month. Thanks for being here today.